Lansoprazole is a proton pump inhibitor, similar to omeprazole, used to reduce the amount of acid your stomach makes. It's commonly used for heartburn, indigestion, acid reflux, and gastro-esophageal reflux disease. The usual dose is 15 milligrams or 30 milligrams once daily in the morning, 30 to 60 minutes before food. Some common side effects include headaches, diarrhea, or constipation and stomach upset. Lansoprazole has the same long-term side effects as omeprazole, so check out our video on omeprazole now. It's important to note that although there are long-term side effects, some people need to take lansoprazole for their health conditions as the benefit outweighs the risk. Always consult your doctor or pharmacist before stopping your medication.